The demonstration here is to show you how you can provide an anterior temporary crown shell utilizing the direct crown polycarbonate clear anterior crown forms. In this particular case, we're looking at tooth number 8, and the patient has already been prepared, numbed and prepared. We're utilizing a model to be able to show this technique. We will try on a temporary crown form to see how it fits. Has the proper widths interproximally. It appears to cover down to the gingiva quite well. You would examine it through a mirror, see that it clears the lingual aspect. So we'll be able to utilize this particular crown shell form, which is to be used on the anterior tooth number 8 here. This particular shell form is the XL shell form. At this point, you'll have to make a decision which way you want to line this crown shell form, whether you're going to be using an acrylic technique or if you're going to be using a Bis Acryl technique. This very first form that I'm going to use is going to be the Bis Acryl technique. You would choose a Bis Acryl, and there are many of them on the market that you could utilize for this. You'd use a Bis Acryl that is in the proper shade that would allow you to be able to match the adjacent tooth. Utilizing a bluestone tooth, obviously we can't match that shade, but it'll be interesting to show you how utilizing a tooth-colored Bis Acryl material will still allow some of the blue color to come through this translucent shell and the actual lining Bis Acryl. In utilizing the Bis Acryl technique, what you have to do first, after you've verified that it fits, is you need to use Bis Acryl varnish. For these polycarbonate crown shells, there are 2 on the market that we're recommending at this point in time. Stern Gold and Sultan both have a Bis Acryl varnish that you can utilize for this procedure. So we'll take and utilize the varnish by placing a small drop inside of a dappen dish so we don't get any cross-contamination. And utilizing a brush, we will paint the internal aspects of this restoration, just creating a surface reaction that will allow the Bis Acryl to stick to this polycarbonate shell. Once you've lined all the surfaces you want the Bis Acryl to stick to, you would go ahead and cure the Bis Acryl varnish for 30 seconds. All right, after curing it for 30 seconds, you would take your Bis Acryl lining material and deliver it. Well, first of all, I'm going to recommend that you take the tab off because you're going to probably have had to have trimmed this particular model. The trimmed polycarbonate crown shell is now ready to be lined with the Bis Acryl. What we will do is line directly into the shell, but I'm going to recommend that you take just a little bit of the excess Bis Acryl material and get it started outside and then go into the crown shell form and fill, keeping the tip embedded into the material as much as possible. Figure out exactly how much you would need to fill this. Made it back to the tooth. And at this point in time, in the patient's mouth, what you'll be able to do is, utilizing a brush or instruments, take a little bit of the excess away so that it makes trimming this a little easier in the final trimming stages. The nice part about Bis Acryl is that it gets a set fairly rapidly. And what we'll do is take it to the point where we have a decent set to the material, and you can see we have it adapted fairly well to the tooth. That will give us a very nice provisional restoration. We're going to let that set to the point where it gets into a rubbery stage. By taking a little excess out, you'll see that I'm able to test the material. It's starting to get that real rubbery stage at this point. I will, to keep it from locking into the undercuts, I'll take it on and off a few times to make sure that it doesn't get locked into the undercuts. And then once you have it adapted and it has set according to the manufacturer's time constraints, you would take it off from the tooth and go back to the lab and do the final polishing of the restoration. Once your assistant has trimmed and polished the final temporary restoration, you'd bring it back to the patient's mouth, test it, make sure of marginal integrity, make sure that the floss is holding the adjacent teeth where it needs to be to maintain the interproximal positions of those teeth, and you would cement it to place utilizing a good temporary cement that you would utilize for any of the other provisional or temporary restorations that are there.